Hello, this is Justina Mutale. I am African Woman of the Year. I'm also Chairperson of the Africa Advancement Forum. I run two of my own organizations, the Justina Mutale Foundation and also Positive Run with the Global Catwalk to stop the spread of HIV and AIDS, and now to stop the spread of the coronavirus. The quick spread of the coronavirus around the world indicates to us that indeed we do live in a globalized and interconnected world where if one thing happens in one part of the world, it's bound to spiral into all the four corners of the world. The coronavirus has caught the world totally unawares. No country or government in the world was prepared for the coronavirus, which has put the world on a standstill, set the world economy into freefall, making the world economy lose trillions and trillions of dollars in such a short space of time. So what would be the impact of the coronavirus onto Africa, whose countries already have weak economies and weak public health services? African countries depend on natural resources as their exports to earn revenue. Countries such as Nigeria and Angola depend on oil, which make up 80% of their national budgets. Countries such as Zambia and South Africa depend on the mining industry. My country, Zambia, depends on copper as our highest revenue earner, and whenever the price of copper goes down, the economy of Zambia goes into reverse. Also, the tourism industry has been put on hold or collapsed, and hotels and restaurants have closed. People have lost their jobs. The countries who depend on the tourism and hospitality industries have lost revenue, thereby weakening further the economies of those African countries that depend on tourism. Furthermore, most African countries have their local currencies pegged to the US dollar, and a strong US dollar automatically devalues the local currencies of those countries that are pegged to it. What can we do, or African leaders do, or Africa as a continent do in response to the coronavirus? To start with, I believe that African governments should implement as much as possible the recommendations from the World Health Organization wherever possible. However, I believe that it would be advisable for African countries to think outside the box. If African countries can think outside the box and customize those recommendations to fit the situation on the ground, to fit the reality on the ground, the reality in those countries, the socio-economic conditions, to fit the economy, the infrastructure, and everything else that has to be taken into consideration. Because African countries do not have the options that other highly developed economies have. They do not have those options, and they do not have well set out welfare, social welfare systems or social protection systems. So they need a complete lockdown. While a complete lockdown can work in developed countries such as the UK and the USA, this would be totally impossible in African countries where people depend on a day-to-day income. A lot of people are in the informal sector, and also most governments in Africa do not have proper social protection systems in place. There's no welfare. For example, if somebody loses their job today, the government is not able to look after those people as they are able to do in the UK and other developed countries. So having a total lockdown for those that depend on day-to-day income, it means a choice between dying from the coronavirus or dying from hunger. What African countries can do to have a staggered lockdown so that while handling the coronavirus situation, the economy can still continue to run. And also, most people in Africa do not go to the supermarket to buy their food. They do not have refrigerators, and they do not have at any one given time enough money to be able to stockpile for weeks and weeks during a lockdown. They need to go out and buy their food. First of all, they go out to earn their money every day. At the end of the day, they go out to buy their food with that same money, hand to mouth each and every day. So and they buy their food from open public markets, which sell fresh foods, and the food has to be eaten to be consumed fresh, because of course it cannot be stored. So those markets should be kept open to keep the economy running, and also to feed the people. The idea of handing out food to people, I think it's a very complex exercise to be carried out in African countries, especially where you don't know where to find people. People do not have proper addresses that you can find the people and know that yesterday we delivered food at this house and tomorrow we should go and deliver. The best thing would be to provide social cash transfers wherever possible, so that people have the option of buying their own food and should not be forced to eat the food that is handed out to them. And markets, to keep the markets open, what can be done is perhaps reconfigure those markets so that people can observe social distancing when they use those markets. And at the entrance of the markets, maybe to build disinfectant cubicles and also running water taps with soap and sanitizers. So before anybody enters the market, they can go through the cubicle and get disinfected, and also wash their hands with running water, soap and sanitizer before they go into the market. And also, if the markets can be fumigated first thing in the morning before they open, and also last thing at night after they close. The same thing should be applied to most of the public places, such as the bus stops. If all bus stops can have disinfectant cubicles, running water taps, soap and disinfectant, so that before anybody gets onto the bus, they can go through that disinfectant cubicle. And also buses should be disinfected before people get on it, and also when people get out of the buses. I believe that would help to reduce the spread of the coronavirus. Another thing would be for most African governments perhaps to opt for what would be called twin goals of testing and containment, because we don't have so many resources to be testing people at random. It'd be a good idea to test only those that exhibit signs of having the symptoms, and follow that up with what is called contact tracing. So once you've got the person who's exhibiting those symptoms, test that person, and if they are positive, trace their contacts and test them as well. Those that are found positive should be quarantined away from the and taken away from the public, so that those who have the virus can be quarantined, while the public can carry on with their day-to-day life, but without the threat of contracting the virus from the next person. Also, African countries perhaps could try and lobby the international community for debt relief, so that the money that is currently being spent on servicing debt can be brought back into the economies of those African countries to try and help tackle the coronavirus. Another step further to go would be for African countries to try and lobby and fight for closing down all the loopholes that allow tax dodging by multinational corporations, so that those multinational corporations operating in African countries can pay the due tax, and so that the full taxes that are collected from multinationals can be put back to circulate in the economies of those African countries to help those countries fight the coronavirus. Another thing I would like to suggest is that Africa has got a lot of immunity boosting indigenous foods, indigenous fruits and vegetables. Perhaps this is the time when African countries can encourage their citizens to go back to basics and eat the indigenous immunity boosting organic foods that we have in abundance in Africa. And what can we as citizens do to contribute to the fight against the coronavirus? As citizens, I think it's time that we all should embrace the philosophy of Ubuntu, the African philosophy of Ubuntu that tells us that I am because you are. The philosophy of Ubuntu tells us that we all belong to a greater whole, that humanity has one common bond, and the suffering of others is our own suffering, as has been exhibited by the coronavirus. So we should all pull our resources together, pull our efforts together to help fight the coronavirus in whatever way that we can. Africa has a lot of billionaires and millionaires and other people of substantial means who can come forth and contribute and help to fund the fight against the coronavirus, whether it's to help build new hospitals or furnish the hospitals, buy ventilators, masks, gowns, gloves, or whatever medical equipment is required, or treatments that are required to fight the coronavirus. If our billionaire and millionaire brothers and sisters around Africa can pool their resources together to help save the lives of Africans, to help save Africa as a continent, that would be great. Those who do not have substantial means can come up and just volunteer in whatever little way that they can. For example, my organization, we have embarked on a campaign where we are asking African seamstresses who are able to sew African print-inspired face masks, which can help those the underprivileged who cannot afford to buy the proper face mask. But we understand, as announced by the Center for Disease Control and Prevention in the USA, that whenever anybody is going out in public, they should have some kind of cloth covering their nose and mouth. It doesn't need to be surgical or medical. So that is what we have done. That is the little that my organization is contributing. Others can also contribute by just helping to disseminate the important information. Those who've got television, newspapers, magazine, blogs, YouTube, podcasts, as long as it is the correct information. In the UK and the USA, every day, as I said, the coronavirus caught each and every country unawares, and each and every country is trying to tackle this as we go along. Every day in the UK and USA, there is 1 or 2 press conferences by leaders trying to update the citizens on new information, new ideas, new directions, and new guidelines on how we are tackling the coronavirus. So if those who are able to even just disseminate that information, perhaps go around the markets and update the women in the markets, or underprivileged people who do not have a radio, they do not have a TV, they don't even know how to read a newspaper, maybe by word of mouth to update them, that would really be brilliant. So what lessons can we learn from the coronavirus? What lessons has this brought up onto us? I think the biggest lesson that we have learned from the onset of the coronavirus is that what really matters in a person's life is to have the life. It's the health, our health and nutrition. Because during the lockdown, for example, in the UK, we are all locked in. Our cars are parked outside. As I said already, aeroplanes have been grounded, including private jets. We are all locked with all our beautiful clothes, our beautiful handbags, perfumes, and all those things that we always consider to be important. But for now, everyone is fighting for human survival. We are just fighting for our lives. That's what it has come to. So that is why this should not be a time to play the blame game, and it shouldn't even be a time for politicking, for people to try and get political mileage out of this. It is a time to pull our resources together to save our own lives. As I said, Ubuntu, we are all interconnected. As the coronavirus has shown us, we are interconnected through globalization. So if you do not help the next person, coronavirus does not choose whether you are a minister, whether you are a servant, whether you are a president, whether you are in opposition, whether you are young or whether you are old. It will just get anybody that can be got. So each and every one of us are fighting for human survival. That is why we all need to get together and put our resources together to save Mother Africa.